Hi guys, welcome to Schools of Consciousness. We are Galia and Jess, and today we want to talk about the difference between regular therapy and spiritual psychology, and why is it so important to talk about this. I want to say, and I want to share with you guys, that both of us actually struggled with our mental health at some point in our life. And it was so hard for us, I think, to feel heard and accepted and really seen in this pain. And this is really key to understand that there's this failure in the medical system, because they fail at understanding that we are suffering from a soul sickness. We're not suffering from a mental illness, but a soul sickness. And this is what we want to express today. And how can we start doing this work, this deeper work, to understand what is the root of this suffering?
Yes, and it's very important for us to talk about this today, because more than ever, people are suffering from mental illness. And mental illness and suicide have become the number one topic, in the last 2+ years. So I want to share with you guys that in the past, I was in the grips of the mental health system in California. And at that time, there wasn't much advancements, and there was definitely not much talk about somatic work as we hear it today, or about trauma healing. So when I was receiving the help, I was seen only as my diagnosis. And I was diagnosed with bipolar 2 disorder, and they just saw me as my symptoms. And they were medicating me, numbing and suppressing what I was going through. And I always knew, and I would tell the psychiatrist and my whole team, like, I don't want medication, And I always felt like I could change this, but my therapist and my psychiatrist said, no, the only way that you can live a regular, normal life is going to be you taking your medications and seeing a therapist and psychiatrist for the rest of your life, because your disease is as if you had diabetes and you need to take medication. And without that medication, you will not be able to live a regular life. So when they would tell me this, it made me feel so limited. And deep down inside me, I knew that was not true. But also, there was something going on that I was experiencing that I couldn't understand, because at the same time, I was going through a lot of madness, a lot of experiences that were not pleasant, and were coming from this place where I seemed like I was in other worlds, because what I was experiencing actually was psychic abilities, remembering past lives. I was living in different dimensions, and they were all being experienced in other dimensions. So when I was in this physical dimension as Jess, I felt like I was actually in other timelines. I didn't feel like Jess, right? So then the doctors called this psychosis. But because they were limited, only seeing me as a patient who was suffering from bipolar disorder, they were just going according to the diagnosis of a bipolar disorder, and what's happening, trying to rationalize my soul and what I was experiencing that they couldn't understand. They saw this as psychosis, while what was happening is I went through an initiation and I tried to commit suicide, and that activated ancient memories stored in my cells, and they began to present themselves as flashbacks, as memories, as remembrances of ancient wisdom that I knew within me. But it was all distorted. So at times I was stuck in Egypt, in ancient Egypt. I was going through different timelines of the past, remembering past timelines, seeing also future timelines, seeing the destruction of like the earth, the fears, all of this. I was living in different dimensions and I was not connected to this body, right? But this was seen as psychosis. And this is when our psyche, right, when it's out of balance and not understood, it can turn into a psychotic episode.
Thank you for sharing this. And the label, this is something really important, because if we identify too much with the label, well, this is really hard to tap into our higher self. And this is what I've noticed in the system. It's that it's really disempowering. It's really disempowering because you are talking with people who only want to treat your disease. And these people are not seeing you on an individual level. They're not truly seeing through you. And this is painful, you know? So this is what we are changing, and the dynamic is completely changing with spiritual psychology, because now you are at the center of everything and you have the potential to actually awaken on a cellular level, to understand things on a deeper level. And that's why I liked when you mentioned about traveling these different dimensions of your being and understanding different realms and letting yourself experience, right? These waves. And this is the work that we are doing with spiritual psychology. It's now, for instance, in my own work, I'm calling this process soul retrieval. Why soul retrieval? Because this soul retrieval includes this remembrance and this desire to call back the soul pieces of yourself that have been fragmented, that have been dissociated from your being through trauma, through traumatic events, through this deep suffering, this deep sorrow. We can see a bridge somewhere between psychotherapy and spiritual healing. There's a bridge. Spirituality and psychotherapy can work together. And why? It's because we can understand our dysfunctional patterns. We can become aware of our dysfunctional patterns. And this is really important because everything starts from this awareness. But secondly, we need to integrate this knowledge inside of ourselves. So now we are going to learn tools to manage our trauma responses. We are going to learn tools to feel whole, to feel complete, right? And this is what spirituality is giving us. It's giving us this missing part that we are craving, that we are truly craving this connection to spirit, higher realms of existence. And this is all possible through this exploration of the subconscious. And the subconscious is this gateway to experience spirit. So when there is this great awakening to our traumas, and for the people who have been following our journey, who have been following actually my work, I'm talking about this. I'm talking about awakening to our traumas. Why am I saying this? Because we are going through an activation. We are going through an activation of our light body. We are remembering past timelines that are responsible for our suffering, this soul suffering. So this is why it's really important to integrate spirit into the healing process. And I'm sure you'd like to share more in depth. And I know you are doing an amazing work with astrology and integrating astrology and psychology. And I would love for you to share what it looks like truly to be able to understand our patterns with the alignment of the planet, etc. I would love to know this.
Thank you for that previous discussion and what you were talking about, and I wanted to mention that the pioneers of psychology actually were the shamans, because the shamans, they are the seers in the dark. They're traveling in different dimensions. They're traveling in the soul dimension. So they, the shamans of the past, right, the medicine men and women, they were doing shadow work, but back then we were at a different stage of human development, and the development of consciousness. And then we had to have the continuation of evolving the psyche, the study of the psyche, which is the study of consciousness, the soul, psychology. Now we have, Carl Jung, who left his work, and he was studying cosmology. He was studying the planets, astrology. He was studying the ancient teachings, because there is power in integrating the ancient teachings with what we now call modern. You see, in the modern traditions, they've been limiting just to the physical plane when it comes to modern day medicine, which again, we have discussed this in previous podcast episodes, that there is an importance, especially when it comes to emergency medical things, right, that are great about Western medicine to keep us alive so we can stay in our bodies, right? Exactly. But when it comes to long-term health, this is when it's important to have a holistic approach, because the type of emergencies, the type of medical care that we have now is more focused on treating the illness, the disease, or the accident, right? But when we take a look at the holistic approach, we're seeing all dimensions, not just the physical, but we're looking at the physical, the spiritual, the emotional, the economical, everything, society, right? We're seeing the micro and the macro. And that's why when we incorporate these tools that help us understand ourselves, and it's not just looking at the person who is showing all these symptoms of a so-called illness, right? But we can look at the individual, and this is why I love studying astrology as a powerful tool to understand the human psyche and why we manifest the patterns that we manifest. And something that I've been studying deeper into is the planet Neptune, and how people who have conflicted Neptune placements in their birth charts, they tend to be the ones that are, for instance, labeled mentally ill, or they have addictions, or they maybe hear voices, right? There's a lot of people with some strong placements where they have psychic abilities, but it manifests through schizophrenia, right? Maybe they're tapping into other dimensions and they don't understand it, and maybe they're hearing voices, and then their parents are worried about them, and then they get diagnosed as schizophrenic, when actually it can be that they're going through a certain transit, Neptune transiting a certain aspect in their chart, and they have some abilities that are psychic that they've developed because they have this connection, this deep connection to spirit, right? But then in this lifetime, it transits through a certain aspect in their life, because in astrology, every house is like a dimension of the self, right? So what I've noticed, and I've been studying in clients and in myself, these placements, and I can see how, right, these astrological placements have everything to do with that individual going through a life process. So if we can integrate tools such as astrological psychology, energy healing, understanding energy, right? Understanding ourselves as electromagnetic beings, now we can really heal. Because if we're just seeing this from a physical approach, limiting things to just a disease, right, or an illness, and not seeing things as a whole, then we can't really help anyone heal and grow. So whatever we experience, we have to see this on a holistic approach to understanding what's actually happening, and that everyone is undergoing their individual process. So what may look insane to somebody else is actually them going through an awakening.
Yes, and I loved what you shared about the shamanic practice and shamans, and how shamans were actually the pioneers of psychotherapy. And it can be so funny to say this in this way, but right now we are giving all power to a practice that was born last century, when like actually this is a practice, this is a knowledge, a wisdom that was here like way before, and this is just a rediscovery of shamanism. What we are experiencing now with psychotherapy, this access to different realms through the subconscious, right? And creating this bridge between the conscious and the subconscious, we are just rediscovering this. So what we are doing with our teachings is that we are bringing back these ancient teachings that are now forgotten by most of people. And this is because we have forgotten about our spiritual nature. So thank you so much for watching us, for supporting us. We appreciate you. Please don't forget to subscribe, leave a comment, show us some love. This is really important to grow this channel. My name is Galia.
And I'm Jess, and we look forward to sharing more wisdom with you on the next video.
Tormenting childhood. I remember. I remember. I remember. I remember the vehemence of my words and thoughts, the brutality of my feats. I remember observing my incarnation and regretting the day of my birth. I remember hating mirrors, the unbearable truth of my physical dejection. I remember dwelling on my miserable existence. I remember the madness consuming me. I remember inflicting pain on myself, a yearning to rip the flesh of the bones and see through the deception of matter. I remember calling myself a monster, a time where societal images were appealing and poetic. I remember a deep hatred for everything, including myself. I remember pretending, I remember defending my excitement for life. I remember worshipping death in every breath and dreams. I remember the tender melancholia of my sentence. The love was the sacrificial pain. The love was the sacrificial pain. I remember armchair psychologists. I remember lying to them. I remember at 14 years of age thinking, what can you know but the mysteries of my soul? You who only contemplate the mundane and vain affairs. You who only contemplate the mundane and vain affairs. They wished to lock me up in the psychic world, to make my genius mind prisoner of substance and neglect. I flew away. I remember questioning faith, religions, institutions, belief systems, prohibitions, art and God. I remember the long nights of distress, bathing in alcohol and cigarettes to escape. There is no God. I'm condemned to eternal suffering. I remember thinking if hell existed, it would be a better place.